I believe we have a quorum, and I haven't seen the numbers change in the last minute or so. So I think that we have people here that are intending to come. I'm Dr. Karen Antman, the provost of the BU Medical Campus and the dean of the School of Medicine. And I'm delighted to welcome you today to the installation of Dr. Tuhina Neogi as the new Alan S. Cohen Professor of Rheumatology. Installations are those joyous academic events that celebrate two Boston University School of Medicine professors, one historic and the other a new, younger, outstanding professor as well. This professorship honors the late Dr. Cohen, who graduated from BUSM in 1953 and trained at Boston City Hospital and established the first arthritis section at BUSM in 1960. More on him from other speakers. He served in leadership roles until his retirement. I'd like to acknowledge the family of Dr. Tuhina Neogi, her mother, Dr. Neely Ma Neogi, her husband, Dr. Scott Blyer, her father and mother-in-law, Dr. Joel and Mrs. Noel Blyer. And I'd like to thank Dr. Maria Trojanowska, who supported splitting the Cohen chair into two distinct chairs, the Alan S. Cohen Professor of Rheumatology, which is Dr. Neogi, and the Alan S. Cohen Professor of Arthritis, which is Dr. Trojanowska. I'd like to now introduce Dr. David Coleman, the Wade Professor and Chair, Department of Medicine. Dr. Coleman.
Thank you, Dr. Antman, and I'm delighted to welcome all of you on this call to this joyous celebration of the induction of Dr. Tuhina Neogi as the Alan S. Cohen Professor of Rheumatology. These events are really very special because, as Dr. Antman mentioned, we not only get a chance to honor the legacy of Dr. Alan Cohen, who you'll hear more about in a moment, but we also have the opportunity to honor and acknowledge the innumerable contributions and example of Dr. Tuhina Neogi. Just very briefly, Dr. Neogi is a professor of medicine and epidemiology in the Boston University School of Medicine. She serves as chief of our section of rheumatology, a position she has held since 2019. We were very fortunate to recruit her here in 2003 as a research fellow after training at the University of Toronto. She was made a faculty member, assistant professor in 2006, and in 2016 was promoted to full professor. Her many, many accomplishments are filled with description of honors from peers, from service to local and national organizations that have been involved in setting the standards of care and treatment for patients with systemic rheumatic diseases, and in particular with osteoarthritis and gout. It is in these two areas where she really is known throughout the world for the clarity of her thinking and her ability to bring methodologic rigor to the important studies of these conditions. I'm perhaps really excited about the honors she received from this Department of Medicine, first as a Evans Junior Faculty Research Awardee in 2009, and then in 2016, she received the Research Mentoring Award from our department. She has had numerous mentees who've gone on to very successful careers and have benefited from her wise counsel and her example. More recently, she has played a critical role in the development of career development programs for our faculty and fellows, and has played an instrumental role in our growing efforts to promote diversity, equity, inclusion, and belonging on the medical campus. But I would say the characteristics and accomplishments that perhaps I value most are her care for others, the way that she advocates for her peers and for her faculty and fellows, for the generosity that she shows in virtually everything that she does, as a mentor, as a role model in the Department of Medicine, for her thoughtfulness, for her sensitivity to the sensibilities of colleagues and all members of our departmental community, for the way that she sets standards through not only her example, but the way that she does not settle for anything less than excellence in herself and in others. I'm so grateful to have Dr. Neogi as a leader in our department and to have the opportunity to work with her and to learn from her. I could not be more pleased today to join with all of you in celebrating her recognition as the Alan S. Cohen Professor of Rheumatology. I will turn now to introduce Dr. Robert Sims, who is former chief of rheumatology and a longtime physician investigator in our department, currently emeritus professor of rheumatology, who can speak more to the legacy of Dr. Cohen and the history of the rheumatology section. Rob?
Thanks, Dave. I'm going to put on the screen share here for a second and switch over to a little PowerPoint presentation. Bear with me for 1 second here. Well, thank you for the opportunity to spend a few minutes talking about Alan S. Cohen, who was the chair of rheumatology when I was a fellow back in 85, I believe. So Alan went to Harvard, where he graduated in 1948 with magna cum laude and Phi Beta Kappa. He then became a medical student at BU, graduating in 1952 as the class valedictorian. He was AOA. He then did his internship and residency at the Boston City Hospital on the Harvard service, spent a couple of years at the US Public Health Service, and then joined Walter Bauer at the Mass General for one of the first rheumatology fellowships available at that time in the country. After he completed his rheumatology fellowship, he became an assistant professor at BU and had a storied and long career, as Dr. Antman pointed out, at BU, including a couple of highlights. He was the chief of medicine at Boston City Hospital for 20 years, from 1972 to 1992. He was the director of the Thorndike Laboratories, which were the famed laboratories and the first clinical research center in a municipal hospital in the country. His contributions to amyloidosis were enormous and internationally recognized, beginning in a landmark paper in Nature in 1960, which described the fibrillar nature of amyloid fibrils. He started the BU program and kind of famously and mythically offered Martha Skinner, then a BU rheumatology fellow, 2 research projects. One was a catalog of synovial fluid analyses, and the other was a mouse amyloid project. Fortunately, she chose the latter and went on to become internationally recognized and the leader of the amyloid program after he stepped down later on. She eventually handed over the leadership reins of the amyloid program to David Selden in 2007, and she's now emerita professor. In terms of his contributions to rheumatology in general and BU rheumatology specifically, he established the program really in 1960. He was part of a large group that published a seminal paper back then in approximately 1980, which was criteria for the diagnosis of SLE. He became later president of the ACR, achieving its greatest award, the Gold Medal Award, and he was also a master of the American College of Rheumatology. A couple of other landmark events was hiring Robert Meenan, who was a leader in patient-oriented research and later became director of the School of Public Health, and began a long storied history of incredibly successful funding, NIH and otherwise, beginning with the NIH Multipurpose Arthritis Center, which was continuously funded until the NIH changed the funding rules for arthritis centers after about 20 years. Another key landmark event in this story was David Felsen, who was Robert Meenan's mentee, who later had and continues to have a storied career founding the section of health services and epidemiology, and is going to speak a little bit later on as well. Ellen, of course, endowed the Alan S. Cohen Chair, now of Rheumatology and Arthritis, as you've heard from Dr. Antman. Another seminal event was hiring Joseph Korn from Connecticut, who became the rheumatology section chief when Alan stepped down in 1992, and founded the BU scleroderma program, which I eventually took over and became section head in 2008. Another seminal event was the installation and hiring of Maria Trojanowski, friend and colleague for many years with me, who was the Arthritis Center Director and is the Alan S. Cohen Professor of Arthritis, actually not rheumatology, a small difference. And of course, now, as you've already heard, Tuhina took over in 2020 after both rheumatology and clinical epidemiology and health services research merged into a common section now headed by Tuhina. The Arthritis Center is now the Arthritis and Autoimmune Disease Research Center. And it's delightful to acknowledge that Tuhina is the new Alan S. Cohen Professor of Rheumatology. Congratulations, Tuhina.
Okay, thank you, Rob, very much. Appreciate those historical comments. Our next speaker, I'm really especially delighted to introduce a special guest from outside our department, and actually someone who has known Dr. Neogi for a number of years, including especially her time in Toronto. Dr. Gillian Hawker is the Sir John and Lady Eaton Professor and Chair of Medicine at the University of Toronto. She is a rheumatologist and clinician investigator of the first order and works at Women's College Hospital and the Institute of Health Policy Management and Evaluation at the University of Toronto. She is internationally recognized as a leader in osteoarthritis research, and I'm just delighted that she's offered to join us today in celebrating Dr. Neogi's installation as the Alan S. Cohen Professor of Rheumatology. Dr. Hawker?
Thank you very much. It's really my pleasure to be here. And you're right, I've known Tuhina now, I think at least 20 years. She was a resident from 2001 to 2003, and many of our University of Toronto colleagues are on the phone. In fact, Tuhina, I think you've done better than most medical grand rounds in attendance right now, so way to go. I have had the pleasure of knowing Tuhina for a long time, and it really dates back to her residency. Unfortunately, she got away from us, although as chair of medicine, I'm still trying to recruit her back, but Scott, who's someplace here, but I can't see him. Oh, there he is, right in front of me. Won't let her come back. Tahina was always an incredible rheumatologist, but like I was supposed to be sent off to David Felsen at the end of my rheumatology training. Of course, I had 2 little kids and wasn't willing to go, but Tahina agreed to go when Claire Bombardier pushed her out the door. And she landed in BU with David. And, you know, I think it's pretty hard to land with David Felsen and the Framingham cohort, and then the Most cohort, and a whole heck of a lot of talented young people, and Mike, who I see there, and Dan, who I see there, lots and lots of talented people. She rapidly emerged from an undifferentiated rheumatologist to really, forget the gout, she's an outstanding osteoarthritis researcher. And you know, you've already commented on her rapid ascent through the ranks. That would never happen at U of T except for superstars. So she must be a superstar, all the way from assistant to full professor in 10 years. Pretty incredible. Some of you may not know that Tahina really has hit every sort of stellar benchmark of a rheumatologist's research career. She's got all of the big highlights. The Arthritis Foundation's Satterfield Research Award in 2009, then ORSI, our International Osteoarthritis Research Society's Young Investigator Award in 2013, then the Henry Kunkel Young Investigator Award from the American College of Rheumatology in 2014, and now this incredible honor with an endowed chair. A bit of a context, being an osteoarthritis researcher in the midst of a rheumatology division section group that is heavily systemic. It is kind of hard. Maybe it's easier having David sort of running roughshod over everybody else, but it is, I can tell you from my perspective, sorry, Toronto folks, but you know, I appreciate David actually said that this was a systemic inflammatory disease. I do believe osteoarthritis is, but often we osteoarthritis people are not considered real rheumatologists. So, you know, to have such admiration from the rheumatology community for one that is so devoted and has contributed so much to OA is just amazing. I know David's going to follow me, and I know he's going to talk about, David Felsen that is, he's going to talk about her research a little bit more. But I wanted to give you a few observations of my own. I mean, I think Tahina's work really is a series of seminal discoveries. She doesn't do anything little. She does it big. She makes big differences. Her work on elucidation of pain phenotypes, the relationship of pain phenotypes to structural change, to symptoms, to postoperative pain following joint replacement, all of the things she's spent her time doing have had really pretty fundamental consequences to how we think about OA and hopefully how we ultimately find a cure for OA, or at least effective treatment. Her reputation has really garnered her the productive research career that she's had. And you also already mentioned the students that flock to her from all over the place. And I was particularly delighted because I always think it's the best sign of a really talented researcher is the talent that comes to them and how well they do when they leave the flock. And Tahina has done a brilliant job. But really what I want to talk about is her unique manner in which she does her research, conducts herself as a researcher. Because she may be small, but she is mighty. That Tahina is an influencer. She is a key informant. She's a respected expert in our field. And besides being extremely brilliant and meticulous and gifted scientist, she's really the voice of evidence-based reason that we all really listen to. When she talks, people listen. And balanced with her very high integrity and humility, she has an incredible commitment to evidence. She's innately curious, driven to find answers, and really unafraid to challenge long-held beliefs and opinions. And perhaps the best example that she knew I was going to talk about was in our joint work to develop the first ever joint European and American College of Rheumatology classification criteria for rheumatoid arthritis. Now, This was a challenge just bringing the Europeans and the Americans together. But it was also a challenge because I'm not an RA person, but it was a group of very, very strongly held opinions attached to very strong people who needed to come together and move us forward about the most important condition in rheumatology, which is RA. And Tahina was one of two young faculty. In fact, it was right after you became faculty at BU. I looked back at my notes. It was 2007 that we started that work. And to say that these were strong characters would be to put it mildly. You know, the type, frequently wrong, never in doubt. When there was disagreement, it was basically Tahina's job with another young faculty member to tell us what the data actually showed. In other words, no, sir, you were wrong. It doesn't support your belief. She said it so magnificently over and over. And when I was trying to sort of keep the group going and trying to generate some sort of consensus, which I honestly didn't think was ever going to happen. I think I told her a few times I was either going to start crying, which is terribly unprofessional, or just walk out of the room. I was so frustrated. Tahina was just this steadfast, magnificent, masterful, calm in the corner on her computer with the data. So, you know, that really made an impression on me. I knew she was destined for serious leadership. She is incredible, and she has made so many amazing contributions to our field, in particular with respect to our understanding of the causes and consequences of pain. And I don't want to speak too long, but I do want to say that I too am very devoted to unraveling osteoarthritis and trying to move us towards some effective therapies and treatments. And pain is the thing that drives people to physicians, to providers, to the healthcare system. And Tahina really has helped to map out what's happening at a physiological and structural and even psychological and brain level in terms of the progression of pain. And for that, I'm very grateful. And finally, she's an outstanding citizen. She is always on every committee, often chairing the committees, just always putting her hand up. And she rarely says no. And I haven't yet seen her do anything but put everything into work she does. I would have said before that I've never seen her angry, but I've actually seen her angry now. So it does occasionally happen. But when I asked one of my graduate students, current graduate students, what she would like to say about Tahina, this was Lauren King, Tahina, Lauren said, well, she thought about it, she said, well, she always comes over no matter how busy she is, even when you're not around, she comes over and asks me how I'm doing, how's my research, how's it going at U of T, and that's Tahina. So to conclude, I really do think Tahina is incredibly deserving of this recognition. I'd still like to recruit her back to Toronto. She has established an impressive track record of research that has advanced our field in OA. She's absolutely internationally recognized for her work and a sought after speaker, mentor, collaborator, and colleague. I really want to thank you, Tahina, for giving me the honor of speaking on this impressively important day. Thank you and congratulations.
Thank you very, very much, Dr. Hawker, for those thoughtful and insightful comments. It's really wonderful to hear your perspective. Our next speaker is Dr. David Felsen, who I think, as all of you or many of you know, is professor of medicine in our department, professor of epidemiology, and directs our training and education and KL2 programs in our Clinical Translational Science Institute. But most importantly, perhaps he is an extraordinary thought leader in the field of rheumatology and osteoarthritis in particular. He's developed a number of novel methods to help us better understand how to document and manage chronic diseases. He is a truly remarkable mentor and has been influential in Dr. Neogi's development, and in fact, her original recruitment here. So I'm really delighted to turn things over now to Dr. Felsen for his comments and perspective.
I started to talk and I was already on mute. So I heard that the New York Times said that one of the most common phrases of 2020 is "you're on mute," which is not surprising. Thank you for those lovely introductory remarks, Dave. And I want to thank also Jillian for saying lovely and appropriate and absolutely correct things about Tuhina. I wasn't going to tell this anecdote, but Jillian sort of prompted me. When Claire Bombardier, who was the chief of rheumatology at University of Toronto and an old friend of mine, sent Tuhina, she had already sent 3 other women fellows for training at BU, all of whom are now esteemed professors. At least one of them is a chair of rheumatology. And she said to me, because she knew that Tuhina would be a star, she said to me, "Look, David, the others have all stayed in the States." Actually, that's not exactly true. One of them is back in Canada. But this one needs to come back to Toronto. Please don't keep her. And I said, Jillian, Claire, I'll do whatever I can. Why don't you send her to me? She's very talented. We'll do our best to train her and teach her how to ask good questions, and then we'll send her back. And Claire, on a regular basis, had her come back as a visiting fellow, later a visiting assistant professor, to see if she could enhance her to come back to Toronto to take on one academic position or another. And it's to our great benefit that we had so much going on that Tuhina ultimately found intellectual challenge and fervor in Boston. But there's another important factor, which is that she found Scott. And Claire kept asking me, has she found a husband? At which point I said, yeah, I think so. And Claire was incredibly depressed about that, because here was the star she was going to recruit back, and unfortunately she didn't. So fortunately for us, she didn't actually. So let me make some comments a little bit and expand upon what Jillian has already said. I think osteoarthritis is, even though it's underdefined by the global burden of disease effort, it's rising in the ranks as one of the leading causes of disability in the world. And we don't know how to treat this disease in any way non-surgically that's effective. It's a big public health problem. I realize in the last year we faced bigger public health problems, but when those diminish in size, we're going to wind up facing osteoarthritis again, which is throughout the world now one of the major causes of disability that we're grappling with. It's driving Medicare nuts because it's breaking their bank, because of all the total knee and total hip replacements that are required in the United States. So Tuhina's actually had a major influence in this field in ways that are terribly important, it's to our benefit to understand. This was a field whose biology was focused almost entirely, when I entered the field, on factors that affect cartilage loss, even though cartilage loss doesn't cause pain. And what Tuhina, in a lot of her work, has refocused this field on what causes pain and why people come to seek care because they're having pain in their joints. And that's what matters to patients and what we need to treat. And this is really seminal work, including an appreciation for the influence of local structural inflammation on pain, on the involvement of the central nervous system, which ultimately changes with chronic pain, to process that pain, on functional and dysfunctional pain in osteoarthritis, and how we want to treat one of them and not the other, and on characterizing exactly how structural changes and pain relate. By the way, the NIH has recognized a lot of this work and has awarded Tuhina 3 R01s in the last year, in part to pursue a lot of this investigative work. Continuing work she started as a research fellow that drew her to Boston She's also been working on vitamin K deficiency, which turns out to be pretty important in osteoarthritis, such that the commonly used drug to treat, to prevent clots, warfarin or Coumadin, turns out to impair vitamin K, which is badly needed for joint functioning. And if you're on Coumadin for a long time, your rate of osteoarthritis goes up and your rate of knee replacement needs goes up. And that's something Tuhina has now well documented. And she's now married the investigations of gout, which I'll talk about in a minute, with osteoarthritis to try to figure out if uric acid in the joint and subclinical gout in the joint causes so much inflammation and oxidative stress within the joint that it itself leads to damage, suggesting a new therapeutic approach that's possible, which is, could we treat our osteoarthritis patients who happen to have elevated uric acid even without gout, okay, with urate lowering treatments that might prevent the damage of osteoarthritis and the pain from osteoarthritis. So these are all very novel and terribly important approaches to a disease that we're not succeeding right now in treating successfully. So let me just comment also on the gout story, because she's also been a major force in the development of that disease and its treatment. This is a highly prevalent disease where studies, even though now we're in a circumstance where we know how to treat this disease, but the trouble we have identified is that so few patients get the right treatment, that treatments are most often inadequate for patients. Tuhina's led efforts to encourage more comprehensive and aggressive treatment. She's led guidelines committees and written reviews of management of gout in the New England Journal solicited and the Annals of Internal Medicine solicited. And her research has let us know also that allopurinol, a urate lowering agent that prevents gout, should not be stopped when patients develop renal insufficiency, something that used to happen a lot, and that alcohol consumption that is discouraged in patients with gout should also include discouragement of wine consumption, which increases risk. Julian has also already said something about Tuhina as an exemplary citizen and has given lovely examples of that, but let me just add my 2 cents there. She provides services on committees where she often winds up being the chair of those committees. She's a sought after mentor. She's a new age academic. She's different from what I was. She collaborates widely, doesn't hold anything back, and offers her assistance to others regardless of what it gets her. When she assumed leadership of rheumatology, I was concerned that she wouldn't be able to get her own research done and lead a clinical service also. But I have seen over the last year or two how the clinical faculty, the fellows, and the staff have responded to her and how she has helped them pursue their own career advancement. At the same time, she has accomplished all that I've just talked about and mentioned. I clearly have no reason to worry. I see a section that has found supportive and nurturing leadership from one of the leaders of rheumatology in her generation. This is a woman who's clearly one of the major leaders of our field. I am proud to have played a role in mentoring her, but like our most talented mentees, I'm not sure, frankly, that she needed much of my help. Let me just comment on Alan Cohen, who, like when Rob said this, Alan Cohen was chair of rheumatology when I was a fellow and appointed me to my first faculty position. He was an outstanding scientist, and he was a founder of what at that time was the nascent field of rheumatology. Let me just say that Tuhina is an extremely worthy person to follow in his footsteps. And I'll end my comments there. Thank you.
Thank you, David. Thank you very much for those thoughtful comments. So my next pleasure is to introduce Dr. Neogi to offer her thoughts and comments. I'm maybe now particularly glad that we're installing her in this professorship, having heard about all of these attempts to recruit her along the way. So maybe this is a just-in-time installation. Dr. Neogi, congratulations on your installation as the Alan S. Cohen Professor of Rheumatology.
Thank you very much. Thank you so much. I am feeling really just honored and a little embarrassed and shy about all of these wonderful things that are being said. And I went and got a Kleenex just before I came into the room, just in case I started to get a little verklempt. And sure enough, I've gotten teary-eyed. So thank you so much for all the kind things that you've shared. And I, I really am very honored and humbled and grateful for this recognition, and really so pleased to see so many people from all different facets of my life, personal life and work life, joining us today. So I wanted to take a few minutes to just share some thoughts about this journey, which I really feel is a serendipitous journey. And because we've been homebound with COVID, my husband and I have been longingly looking at various travel photos. And so I'll be interspersing some of those photos throughout my slides. So some of the characteristics of the people that have helped me along the way, whether it's mentors or other people, it's been generosity, vision, patience, and persistence. And so first I would like to thank and acknowledge Dean Antman, Dr. Coleman, and Dr. Maria Trojanowska for putting this endowed chair together and for selecting me to be the candidate to receive this great honor. And to Dr. Coleman for your patience and persistence in having me consider this section chief position. As you can see, it's not easy to get me to agree to such a position. Of course, I want to acknowledge Dr. David Felsen as section chief of the clinical epidemiology unit, and Dr. Rob Sims as section chief of rheumatology before the two sections were merged, as leaders who really helped us navigate clinical care and research excellence and put our rheumatology group on the map with all of the work that is done in all the different areas that have been discussed. But of course, I need to spend time specifically on thanking David. So while, I kind of always felt that David took a chance on me. I know that I came well recommended from Toronto, but he's been such an amazing mentor and teacher and champion and now colleague, and it's really been wonderful. And so, I have a work parent in David, and he's helped me in so many different ways, in so many ways I probably don't even recognize or understand, and has really helped me ascend at every possible stage. And so everything that I've been able to accomplish professionally is largely in great measure due to the things that David has done for me and helped me with. I often think in research that there's a lot of serendipity, that you have to be in the right place at the right time. But sometimes I think we have to sort of pull back the curtain and see that it's the guide, it's the mentor and the leader who set up the environment, who set up the opportunity to allow you to succeed. And when you come to a point like this, and also when I became a full professor, I really thought about some of the pivotal early research experiences that helped me in this journey to sort of get to this point. And first, I want to just start with high school, in that I was very lucky. I went to public school in Toronto, but I was with a group of friends who were very academically oriented, who supported and encouraged each other. And so back when I didn't know what peer networking was, I already had a very successful peer network. And it was through my friends who were ahead of me in high school that I learned about a program where high school students could be matched to a scientist at the University of Toronto. And so my first research experience was with Dr. Arthur Roach at Mount Sinai Hospital, a neuroscientist. He's now head of Parkinson's UK Research Charitable Organization, but at the time he was an early stage PI in his lab. And there are lots of exciting things going on. And actually one of the people out of his lab is a world famous neurosurgeon, physician scientist now. But at the time, what I remember most is every week when I went from high school to work in the lab, he would meet with me every week in his office. And now when I'm in this position and I understand how busy PIs are, I am so amazed at his generosity with his time to spend with me as a high school student. And I I still remember some stories he told me. I don't remember much about the research I did, but I remember the time. And if I did not have such a positive first experience, I don't know if I would have taken the next step to try my hand again. And then Dr. Charles Dieber is a biochemist at the Hospital for Sick Children. And I remember the research there because I had an aha moment. We made some kind of a discovery. Something came out on a gel and it was really exciting. And I was doing site-directed mutagenesis for CFTR gene, cystic fibrosis. And I broke the news to Dr. Dieber that I'm going to apply to medical school. And I was in my second year of undergrad or something like first year or something like that. And he was disappointed that he was losing someone to research. But he wrote a reference letter for me, which I assume was a good one since I got into medical school. Then my first clinical research experience was in my first year or two of medical school. Dr. Amit Oza at the Princess Margaret Hospital, an oncologist. At the time, a junior faculty, but now head of medical oncology at the hospital. And I did a project with him. I learned a lot. It worked out well. We submitted an abstract. It got accepted to ASCO, the big oncology conference. And I was too naive at the time to realize that was a big deal. And I declined to go to the conference because I didn't want to miss any part of my medical school rotations. But again, what I remember about him is the time that he spent with me. And he was always just happy and he was always excited by research, even though he was crazy busy. He had so much going on clinically and with research, but he really enjoyed it. And I enjoyed my time. And then the other pit stop that I want to share is Dr. Ray Young, a physician scientist at Hospital for Sick Children, a pediatric rheumatologist. This is when I was a rheumatology fellow. And I was really interested in vasculitis, and I was working on a mouse model of Kawasaki disease, and I had a whole path in mind. I was going to be a basic scientist, vasculitis researcher. The research went well. We put in an abstract and it was accepted to the American College of Rheumatology, our big rheumatology meeting. And this time I wasn't as naive. I realized it was a big deal. And so I had my first big talk. And what I remember most is how much Ray helped me prepare that first talk, even at the conference, took me to the podium, showed me how to advance the slides, and also to show me how to move the microphone down to our height, because those podiums are not meant for small women like us. And again, all of these were very positive. And if I didn't have those positive experiences, I don't know if I would have continued trying to pursue research in my career. And of course, this was all complemented by the clinical and research training environment I was in at the University of Toronto. And I apologize to those that are on that don't like your pictures here, but I couldn't really find good ones for everybody. But you can see we were a diverse group of fellows. And here's Dr. Hawker with short hair, like I had short hair back then as well. My co-fellow Sindhu over here on the side. One of the things that is really striking to me when I think about this time is that the statistic of women advancing in academic medicine, about how so few women make it to full professor, let alone section chief, let alone other leadership positions, never occurred to me. And I had a conversation with Dr. Coleman about this a little while ago, about how I never thought about this statistic. And I think back to my experience in Toronto, where we had a dean that was a woman, a chair of medicine, a woman, division chief, woman, program director, almost every leadership position, there were women and successful physician scientists. And so I think that's why the question never came to my mind, because I had so many role models, and representation does matter. And so, as already mentioned, Dr. Claire Bombardier and Dr. Rob Inman were among all the faculty supported my interest in research training, but they not only supported that and encouraged that, but also supported me financially to pursue this. So there I was coming to Boston with my first grant, the Arthritis Foundation grant, that David, who I had not met in person, helped me write in a very short period of time when I reached out to him. And actually I reached out to NILSA here to inquire about training. And the email I got back was from the famous Dr. David Felsen himself. And so that led very quickly to a grant being written and being funded, and then the support of University of Toronto financially for me to move to Boston. And so this is sort of the early crew. And that was a very challenging time to move to Boston, because as a Torontonian, we don't experience this. This is me standing on top of a parking meter, because that's how much snow there was in one of my first winters in Boston. And Sarah Lynn Allaire here and Grace Lowe were always very concerned about me in the winter taking public transportation, and would make sure during these bad weather events that I would get a ride to and from work. I think one of the unique things about the culture that David created in the research training environment is the apprenticeship and teamwork. And one of the key members to make this all work together with David was Dr. Yuqing Zhang here on the right. He was a research epidemiologist, recently retired from BU. And he was, they were doing team mentoring before that was ever a term. So between David's vision, how to ask good questions, what are the exciting things to do, how to conduct research, and Yuqing's epi methodology, I really got excellent training. And he was my PhD thesis chair. He encouraged me to do my PhD together with David's support. And then on the left here is Dr. Jingbo Nu, who was kind of a glue that kept all this teamwork machinery moving. And the teamwork continues regardless of who's sitting in the team. And so over the years, we've had some changes, but some constants. So Mike LaValle is still here, Lisa Massa is still here, Margaret Clancy is still here from the time that I arrived, and of course, David. And then there are some people who've retired recently, Dr. Yuqing Zhang, Joyce Goggins, Dr. Sarah Lynn Allaire. And I put these photos here because the team, the whole is greater than the sum of its parts. What's really wonderful about this culture is that everyone is vested in the success of the team and the success of the group as a whole. We're like an orchestra, we're an well-oiled machine. There's no one single person that outranks everyone else. Everyone rolls up their sleeves to get the work done for the success of the whole group. And so, of course, I took over in 2019, and Rob Sims astutely retired just before the worldwide pandemic hit in February of 2020. And so our past year has been a lot of Zoom with faculty, our staff, and postdocs. And this was sort of the last big social event we have. So there's the clinic, much of the clinic staff on the top, not everybody. A lot of the key members of our administrative staff. And here's this section as a whole for those who could make it to the last boat cruise that we had before the pandemic precluded more in-person things. And right now, when you look at this, you feel very uncomfortable. How could people be so close and not wearing masks? But so I'm very fortunate that I have a great family at BU. But a lot of the research work that I've done is through collaboration outside, as David and Jillian mentioned. And one person I really want to highlight here is Dr. Bob Turkeltaub at UC San Diego. I can't even remember exactly why. Maybe it was the Abbott Scholar Award, but he is, I shouldn't say collaborator here, but really mentor, champion, and sponsor. Before I ever had heard of the terms champion and sponsor, that's what Bob Turkeltaub was doing for me. And he invited me to do some research with him, some collaborations. And I think one of the most pivotal moments of that sponsorship and championing me was in recommending me to write the review for gout in the New England Journal of Medicine when I hadn't really published that much in gout yet. And that pivotal opportunity really opened the door for me in continuing to do gout research. And I have had the pleasure over the years of working with so many people around the world, so many international collaborations, and it's been such a joy. I get to joke that gout has been my hobby because that has been an unfunded research endeavor for the most part for me. I also want to recognize, obviously, the collaborators in osteoarthritis, which has been the bulk of the work that I've done. And these are the co-PIs together with David Felsen, Michael Nevitt, Beth Lewis, and Jim Torner, who the four of them together have been running the multi-center osteoarthritis study, the longest running osteoarthritis cohort study in the world, started in about 2003. And I've been really fortunate that they took me in and allowed me to develop my ideas and pursue research through that study. And then more recently, as David alluded to, I've been working with Dr. Amelia Benjamin and Dr. Rob Edwards, and we've been successful in getting a few R01 grants now to study pain in a broader sense. But I think one of the most fun things for me has been the mentees, getting to work with a lot of fun people, many of whom have become very good friends. And these many people have come from all over the world to get more training and to work. And a really fun thing is that many of my initial mentees are now collaborators, and they have their own mentees. And so Dan White has labeled this family tree as now becoming the mentor grandparent to these individuals. And so David is like the mentor great grandparent to these individuals. But I really have been having such a wonderful time working with a new set of mentees stemming from my original set of mentees. And when talking about family, of course, I want to talk about my family outside of work. And so I'm really fortunate. Here are my mother and father-in-law, who are so supportive and love me like their own daughter. And my father-in-law is a physician, and I know he's so proud of me. I remember an anecdote when I was in the New York Times or the New England Journal. He would like go around telling his friends about that. And so I feel really blessed to have such supportive second set of parents. And here are some photos of my sisters-in-law, my brother-in-law, my nieces and nephew who are on. I can't see them in the gallery right now, so I don't know if they've got bored and ran off, but hopefully they can see that they're acknowledged here. And so when there were important important points in my career, I had two sets of parents cheering me on here at my PhD graduation, before we got married, and here at the ACR award that Jillian mentioned. And of course, I wouldn't be here and be what I am without my parents. And my parents immigrated from India. And, again, serendipity. My father was in Germany for a while, and then he decided to move to Canada to give his family better opportunities. And we're truly a nuclear family. I'm an only child. All our relatives are in India. So it was just the three of us. And my parents really supported me, really encouraged me. I never felt like there was any sort of limitation in what I can do. And, really just supported me unconditionally. And as many of you know, my father passed away a few years ago. Jillian Hawker was really very kind and would visit my father when he was in the hospital initially. And I don't know about you, but if the chair of medicine was visiting my ward every day, I'd be a little bit nervous about that. So my father felt like a real VIP with Jillian visiting every day. And sort of really interesting how the world works and serendipity. Dr. Amit Oza, who I mentioned as one of my early research experiences, he, in desperation, you try to think about who might be able to help you. When I reached out to him, he remembered me, and he happened to be head of medical oncology. And he got onto it right away. And before I could even call my dad to say an oncologist is coming to see him, Dr. Oza had already sent his head of that division to see my father. So now the burden of cheerleading is now double from my mother. She has taken on that double burden enthusiastically. And after my father passed away, we had a trip together to Paris. And she now competes with Scott in terms of who can be my better cheerleader. And sometimes they inadvertently end up wearing the same clothing. And so, of course, Scott has been, one sort of equal and competing with my mother in terms of cheerleader. I'm so fortunate to have such a supportive husband. Again, serendipity brought us together, and in this journey, we've had a lot of great adventures sort of all over the world. And again, I just feel so lucky that he is so supportive of me and so proud of me in encouraging me to sort of continue rising in my career. And so at the end of this serendipitous journey that I share with you, I just feel really fortunate and I'm just very grateful. I get to spend time during the day at work pursuing things that I love. I get to interact with people I really enjoy. And my personal time is also filled with people that I love and enjoy. And here's a photo of flowers and champagne that the section of rheumatology sent me as a surprise on Monday, since we're doing this virtual celebration. But I hope that we get to celebrate together in person sometime soon. So thank you very much for all of your support and for the kind words today. I really appreciate it and look forward to continuing on in this journey.
Tuhina, thank you so much for that wonderful description of your serendipitous journey. I hope you know that the 100+ people that are on this call join together in congratulating you and admiring all that you've accomplished, and are all looking forward to seeing you soar into your very, very bright future. We are so fortunate to have you in our midst and to learn from you. So thank you for all that you've given, and I'm just so thrilled that we